Good afternoon, everyone. I'm Angie Casada here in the WNCT Digital Studios for a Q&A on the coronavirus. And I'm actually joined by Dr. John Silvernail, who is joining us this evening to really break down what the coronavirus is and just hear how it's affecting Eastern North Carolina. He's the director of Pitt County Health Department. John, thank you so much for being here.
Thank you, Angie. It's nice to be here.
Absolutely. So I want to get right to it. A lot of questions have been going around social media. We've been getting a lot of phone calls here in the newsroom, and a lot of things that we've just been seeing, I guess you could say, on TV, throughout the media. And I wanted to break down everything that you need to know when it comes to this virus. So I guess the first question I can ask you, Dr. Silvernail, is what is the coronavirus?
Coronaviruses are a large family of viruses. They produce both human and animal disease. There are generally considered to be 4 common human coronaviruses. Sometimes bronchitis, and in rare instances, pneumonia. There's another group of coronaviruses that produce gastroenteritis or diarrhea in humans. There are also coronaviruses that infect animals, and that's part of the COVID-19 story.
Okay. And going into that, Dr. Silvernail, COVID-19, that's a form of the coronavirus.
That's correct. COVID-19 is believed to be a bat-derived coronavirus that was able to make the jump to people.
Oh, wow.
And infect people. So it is not normally a human coronavirus. It was an animal coronavirus that spread to people.
And how is this virus transmitted?
We believe it's spread mostly by respiratory droplets, which means when someone coughs or sneezes, they release droplets with that cough or sneeze, and those droplets either land on people's hands, perhaps on someone's face or in their eye, nose, or mouth, and that allows the virus to enter that person's body.
Okay. And speaking of it just being the possibility of it being transmitted, what are the symptoms and how do they...
Generally, fever, cough, and if the individual has developed the pneumonia that's associated with COVID-19, then shortness of breath.
Gotcha. And how can COVID-19, the infection, how can it be prevented?
First of all, avoiding folks who are sick.
Yeah.
If you know that there's an area that has COVID-19 circulating, you should avoid that. Frequent hand washing. Covering your cough, so coughing into your elbow or sneezing into your elbow, but not just into the open air, and trying to avoid touching your face, eyes, nose, or mouth without having previously sanitized your hands or washed your hands. And my staff reminded me to bring my hand sanitizer.
You brought it as well.
So that I could do that before I touched mine. Yeah, we unconsciously touch our glasses if you wear glasses and things like that.
Absolutely.
And that's a hard one to break, but we need to be conscious of that.
Now, Dr. Silvernail, who should seek medical treatment when it comes to this? If you're at home and you think you might have a cold or you think you might have a flu and you're kind of scared that, hey, maybe I'm experiencing symptoms of COVID-19, when should you go to the doctor?
I guess I use what we call the prudent layperson definition. If you feel like you need medical care, you should seek Doctors to rule out other common infections first before they test for COVID-19, because many times folks have the flu or some other common infection and not COVID-19. If you know you were exposed to a case of COVID-19, then obviously that's a reason to be tested for COVID-19.
Absolutely.
In terms of going to the emergency room, if you're short of breath and think you have pneumonia or some other cause of shortness of breath, you should go to the emergency room as any prudent person would.
For sure. And now, social media is big, right now, especially when it comes to this coronavirus. You see posts probably, I think when I was scrolling the other day, I feel like every single person on my feed is speaking about the coronavirus. And sometimes social media tends to spread false news. And one article stated that there is a vaccine for COVID-19. Is that true?
Not to my knowledge, no. Think about this, the virus emerged in the end of December, so the development of a vaccine takes months to get a candidate for trial, and then usually a year or more of trials. So our most hopeful estimates are that we might have a vaccine in 12 to 18 months for this infection, given our current technology.
And you know what? We actually saw that the UK was asking individuals if they were willing to be infected with the virus for a certain amount of money. Actually, $4,500 to be exact.
Wow.
American dollars, I should say. What are your thoughts on that, taking that risk? Healthy individuals, they were asking.
Healthy individuals, I would hope.
Yeah.
I guess there's some reassurance in that 80% of folks who get infected with this virus will likely have a mild illness. So if they were healthy young individuals with no underlying medical conditions, that's maybe not such an unreasonable request. And I suppose we do need to study this from start to finish in some model, whether that's a human model or an animal model.
Yeah.
So if volunteers are willing to do that, I guess that's okay.
And, a lot of health professionals are encouraging something called social distancing. What exactly is that?
Well, when we talk about the respiratory droplets that spread the disease, they typically travel 4 to 6 feet in the air at a maximum. So social distancing is the idea of trying to spread our population out to make it harder for the virus to move from person to person. So trying to diminish gatherings, so avoiding concert venues, festivals, things like that bring large numbers of people together that would facilitate the transmission of the virus.
And should, a lot of folks have been, one big thing is that there's been a few scams out there of people trying to sell face masks. And what exactly is that? Should folks wear a mask?
Probably not. I don't have masks in my house. I don't wear a mask walking into Walmart or walking into Food Lion. If I were going to see an infected patient, sure, I would put a mask on and whatever appropriate personal protective equipment would be recommended for that situation. But in general, people, when you look at the videos of people wearing masks, they're not wearing them properly to begin with. And if not worn properly, no respirator or no mask is going to protect you. Where they may have some benefit is for those that are infected, in that the mask can catch those droplets and decrease how far they move from that infected individual.
Gotcha. And don't more people die, Dr. Silvernail, from the flu than COVID-19? And why is this being taken much more seriously at the moment?
Well, COVID-19 is new. It's a novel infection, which we don't have a lot of experience with. We don't have a clear treatment for it or a vaccine for it, so it scares people. Influenza is kind of an old friend or old adversary that's around every year, comes around every season. And while COVID-19 has been brewing since December, the flu season that we track that begins in the fall and officially runs through the end of March, although we'll see flu well beyond the end of March, has quietly infected 32 million U.S. citizens or U.S. individuals, produced about 310,000 hospitalizations, and has killed something on the order of 18,000 people in the country, including 125 children this year.
Now, there are 14 or 15, correct me if I'm wrong, confirmed cases in our state right now.
I believe we're up to 14 individuals
14.
now.
Okay. And the closest to eastern North Carolina would be, I believe, in Johnston County. There's one confirmed case.
Had not heard that yet, but
yeah, and then,
as you said, things are moving very fast.
Oh, yeah. And then, of course, there's some in Wake County. But what is the likelihood of it arriving into ENC?
I think sooner or later it's going to be introduced here, whether it comes back with a traveler, or, from abroad, or someone who comes here from the Triangle area. where there may be some infection circulating. I think it's almost assured that sooner or later we'll have some COVID-19 cases here in Pitt County and the rest of eastern North Carolina.
All right. And, I wanted to take it to our viewers. We made a post on our Facebook, and we just wanted to see what were some questions that you guys, the viewers, wanted to know to ask Dr. Silvernail. And here's the first question. This is from Bree Lexus. She says, is this really as bad as it's being portrayed? And if so, what makes the virus so much more dangerous than previous cases before this one?
Well, I think the thing that makes it dangerous, again, is our lack of experience with it. What we have seen is that for most younger, healthier folks, it is a mild to moderate infection. But in older folks, it does produce more severe illness and in some cases even death. These things scare us because when they present, the thing that presents first with a novel infection are the deaths.
Yeah.
And, we don't know what the burden of disease is, actually, how many infected individuals there are. So when you see the deaths and you look at the deaths in relationship to the number of cases, it looks like the case fatality rate or the death rate from that infection is much higher than it probably is when you have more experience with the disease. So I think that is scaring us.
Yeah. And, Betty Green asks a similar question to this is, how prepared is America to take on COVID-19 and its intensity?
Mm-hmm. I think since 9/11, there's been great amount of federal dollars, local dollars spent on preparedness. The idea of preparing for all hazards, which really means preparing for the common needs. I think we're as prepared as we can be for something like this. We've had experience with other pandemics in relatively recent history. If you remember, in 2009, we had the H1N1 influenza pandemic. So that's still fairly fresh in many of our minds. We changed some of the things in terms of, how do we develop vaccines? How do we develop countermeasures for infections? I think we're in a good position to deal with this infection and have a recent pandemic that many of us were involved with, just 11 years ago.
Yeah. And now Jenny Parham, she says, if you get it and are able to recover at home, what is the expected average recovery time and when can you reemerge into society?
Probably about 2 weeks. We would still want people to stay home for 2 weeks. By the time they become symptomatic, get tested, and recover, it's probably going to be the better part of 2 weeks. The recovery end of this is still a little bit questionable. We don't know how long people shed virus and remain infectious, so we're erring on the side of caution at this point.
And we have one more question here. Patty Hill, she says, what can we do to protect our children while they're in school, all ages? Mm-hmm.
One of the good news, if there is good news in this situation, is that kids seem to be very tolerant to this infection, that they really only suffer a very mild illness and are at low risk, unless that child has some underlying medical conditions, asthma, diabetes, congenital heart disease, something like that. Most kids do very, very well with it. Things you can do to protect your child would be to teach your child the respiratory etiquette, to cover their cough, to wash their hands frequently, to avoid, touching their mouth and eyes, things like that. Avoid sharing things with other kids. Kids are great little bioterrorists. They spread germs very well.
Oh yeah.
They touch something, they give it to their friend when they're really young.
Yeah, I feel like they get sick very quickly.
My toy is your toy.
Yeah.
They share food and snacks and things like that. Those are all means where they can exchange viruses. And some people think that might be why kids are resilient to this virus, because coronaviruses in kids produce mostly winter colds.
Yeah.
And so they're already swapping some of the human coronaviruses, and maybe there's enough similarity to give them a little bit of immunity between them and COVID-19.
Yeah. And, Dr. Silvernail, with you working with the health department, do you know what the teachers are actually telling kids about the coronavirus?
I'm not sure exactly what the teachers are telling them. I would hope that they're sharing the messages that we have put out from public health and that have come down from CDC. I guess it kind of has to be age appropriate too, because this could be very scary to kids when they hear about an infection that doesn't have a specific treatment, that doesn't have a vaccination for it. It could be scary to children. So I think they should tell kids that most kids tolerate this very well. And that if you wash your hands and avoid coughing on other people or letting other people cough on you, you'll probably be okay.
Yeah. And now, when it comes to just hospitals in our area, are hospitals considering limiting non-essential personnel like med students and whatnot? Or nursing students?
Well, I don't speak for our local hospital or
Yeah.
anything. The hospital generally has visitor restrictions that they put in place in the fall for people coming in to visit patients.
With the flu
with
and
the flu and what we call respiratory syncytial virus or RSV. It's a pretty predictable start in mid-fall, and they will put visiting restrictions in place during that time, and then they escalate those as we go through flu season. And I'm sure that they're considering what to do with those restrictions in the light of COVID-19, which, if I can, Angie, right now we still have no confirmed case in Pitt County, which is good. And like I said, I do expect that we will. And we have no evidence that it's circulating in our community at this point. So
yeah. And how have you guys, at least here in Pitt County, and I'm sure you've communicated with other counties throughout Eastern North Carolina, but how are you guys preparing overall when it comes to this?
We have been meeting with our partners. So I've talked to more physicians, I think, in the last couple of days than I've talked to in the last month. At all levels, I've talked to senior leadership at the hospital, at the med school, some of the private practices. We've worked on making sure our messaging is the same across the boards and that people have the right information. There's been a lot of changes coming down from the federal government to the state government to local government, and we've been trying to stay in front of that and make sure that our messaging is similar. Testing, the guidelines for testing have changed rapidly, and thank gosh, LabCorp and Quest, the two big commercial labs, have a test out there now. We're hopeful that other labs will have a test available, and that will speed our ability to make this diagnosis in folks.
Now, a big question that I personally had, I was trying to look back. I'm pretty young. I guess you could consider myself a millennial. But I was trying to think if this has ever happened before. Something so, I guess, I don't know, maybe it's because of the digital era now when it comes to social media and really just highlighting what's happening, not just here in America, but overseas in Italy. And now Tom Hanks has it and everything like that. So I'm trying to remember if this has ever happened before. And just to your knowledge, have we ever had a scare like this around the world?
I think some of this was present with H1N1 in 2009, but I don't think to this degree. And maybe because influenza we have more experience with. But I would say the social distancing, the large shutdowns, to that scale, I don't know that I've seen that in my personal or professional life before.
Yeah. And, as far as just looking throughout everything that you've been hearing, as far as all of the information that you've been obtaining in the past, few weeks, a few months now, what are some big takeaways that you just want our viewers to know right away when it comes to the coronavirus? What are just some things that they need to know right away?
Number one, be reassured that the vast majority of folks will have a mild illness if they get infected. You can protect yourself by washing your hands frequently, covering your cough, avoiding sick folks when you can. I know sometimes you can't always do that, but if you can stay away from somebody that's sick, it's a good idea. Avoid touching common surfaces to some extent. Do I have to touch that? If I did touch that, can I wash my hands or sanitize my hands? Cleaning commonly touched surfaces, especially in office spaces and things like that, doors. And it works for influenza too. Doorknobs, things like that people tend to touch, handrails. Those should be cleaned frequently in offices. And again, we are in flu season, protecting yourself from influenza. If you haven't had a flu shot, consider getting a flu shot. Some people have valid medical reasons not to get a flu shot, but the vast majority of us can receive the flu shot, and that will at least offer some protection against influenza. It won't offer any protection against coronavirus, but at least it'll help protect you from the flu this season.
Absolutely. And one of the biggest things is I'm very big on just, helping the community. And one thing that really stood out is that, and correct me if I'm wrong, but it can affect the elderly at a different level, especially if they're experiencing other, health problems. And I was wondering do you recommend the community maybe helping a neighbor that's an elderly when it comes to going out and getting groceries or just kind of the basic necessities so they don't really have to be exposed to much? I
think if we reach the point where we have COVID-19 circulating in our community, that, helping your elderly neighbor, doing some grocery shopping for them if they need that, that certainly would be a very nice thing to do and would be appropriate to help shield that individual from additional contact.
Absolutely. Well, that's all the time we have. Again, we want to encourage folks to continue to send in your questions that you may have when it comes to the coronavirus and COVID-19. Dr. John Silvernail, the director of Pitt County Health Department, thank you so much for coming in and just breaking down everything we need to know.
You're very welcome, and I wish my citizens good health, or our residents good health.
Thank you so much. All right, guys, thank you so much for watching. Again, tune in tonight at 5, 5:30, and 6 o'clock right here on WNCT.